How to use ibuprofen correctly, what science says. Hey everyone! Today, we're diving deep into how to use ibuprofen correctly. Ibuprofen is one of the most common over-the-counter pain relievers, but using it the right way is crucial for your health. Let's break down everything you need to know, backed by science. What is ibuprofen? Ibuprofen belongs to a class of drugs called nonsteroidal anti-inflammatory drugs, or NSAIDs. It works by blocking chemicals in your body that cause inflammation, pain, and fever. That's why it's often used to relieve headaches, muscle aches, toothaches, menstrual cramps, and even fever. How should you take ibuprofen? The general recommendation is to take ibuprofen every 4 to 8 hours. But the exact dose depends on your age, weight, and health conditions. Always follow the label instructions or your doctor's advice. Important: taking ibuprofen with food or milk can help reduce common side effects like nausea or stomach pain. This simple tip is backed by research showing food helps protect your stomach lining. What is ibuprofen used for? For mild to moderate pain like headaches, muscle soreness, or menstrual cramps. To temporarily reduce fever. Prescription-strength ibuprofen can also be used for conditions like arthritis and more severe pain. Side effects you need to know. Up to 9% of people experience side effects, including nausea, stomach pain or heartburn, dizziness. Because ibuprofen can irritate your stomach lining, it can increase the risk of stomach bleeding. If you notice symptoms like unexplained vomiting, dark stools, or blood in vomit, contact your healthcare provider immediately. Crucial safety tips for using ibuprofen. Avoid alcohol. Combining ibuprofen with alcohol increases your risk for serious side effects like stomach bleeding and liver or kidney damage. Watch for drug interactions. Ibuprofen can interfere with blood pressure medications and many other drugs. Always check with your pharmacist or doctor if you're taking other medications. Don't mix NSAIDs. Taking ibuprofen with other NSAIDs like naproxen, Aleve, raises the risk of bleeding, stroke, or heart attack. Many cold and pain meds also contain NSAIDs, so read labels carefully. If you take aspirin for your heart, ibuprofen can interfere with aspirin's protective effects. Ask your doctor how to space these medications correctly. Usually, ibuprofen should be taken at least 30 minutes after or 8 hours before aspirin. Allergies matter. If you're allergic to aspirin, you might also react to ibuprofen. Always inform your doctor. Pregnancy and breastfeeding. Talk to your healthcare provider before taking ibuprofen if you're pregnant or breastfeeding. They will help you weigh the benefits and risks. Keep it safe. Store ibuprofen out of reach of children and pets. In case of accidental ingestion, contact poison control immediately. How to take ibuprofen. Dosage breakdown. Ibuprofen dosing varies depending on the condition, your age, and your health. Here's the science-backed guide. For primary dysmenorrhea, menstrual cramps. Take 200 to 400 milligrams every 4 hours as needed. Maximum 3,200 milligrams per day if prescribed by your doctor. 1,200 milligrams per day if over the counter. Start treatment as early as you feel pain for best results. For osteoarthritis and rheumatoid arthritis. Minor arthritis pain. Start at 200 milligrams every 4 to 6 hours. Can increase to 400 milligrams every 4 to 6 hours as needed. Max OTC dose, 1,200 milligrams per day. Chronic arthritis or flare-ups. Prescription doses range 1,200 to 3,200 mg/day, divided 3 to 4 times daily. Your doctor will adjust the dose depending on your symptoms. Note: rheumatoid arthritis often requires higher doses than osteoarthritis. It may take days or even 2 weeks to feel full relief. For general pain relief, take 200 to 400 milligrams every 4 to 6 hours as needed. Max doses: 3,200 milligrams per day prescription strength, 1,200 milligrams per day OTC. Oral doses above 400 milligrams per dose don't necessarily provide extra benefit. For use in hospital settings, doses are 400 to 800 milligrams every 6 hours, but must be given slowly over at least 30 minutes. For fever reduction, Start with 200 milligrams every 4 to 6 hours, increasing to 400 milligrams if needed. Max OTC dose, 1,200 milligrams per day. 4 doses in hospital can go up to 3,200 milligrams per day but must be infused carefully. Always use the lowest effective dose for the shortest time possible. Hey parents and caregivers! If you've ever wondered how to use ibuprofen correctly for your child, this video is for you. We'll cover the scientifically recommended doses for fever, pain, arthritis, and more, all based on age and weight. What is ibuprofen for kids? Ibuprofen is a safe, effective NSAID that reduces fever, pain, and inflammation in children. But dosing matters a lot, especially with kids, so let's break down the right doses by age group. Pediatric ibuprofen dose for fever and pain relief. Infants 6 months to less than 2 years. Use infant drops, 50 milligrams per 1.25 milliliters. Dose depends on weight. 12 to 17 pounds, 5.45 to 7.73 kilograms, 50 milligrams every 6 to 8 hours. 18 to 23 pounds, 8.18 to 10.45 kilograms, 75 milligrams every 6 to 8 hours. Max, 4 doses per day. Children 1 to 12 years. Dose is weight-based, 5 to 10 milligrams per kg every 6 to 8 hours. Max dose, 40 milligrams per kilogram per day or 4 doses daily, whichever comes first. Children 12 years and older. Start with 200 milligrams every 4 to 6 hours, may increase to 400 milligrams if needed. Max OTC dose, 1,200 milligrams per day. Important notes on pediatric dosing. Ibuprofen suspension comes in 2 concentrations, infant drops and children's suspension. Always check labels carefully to avoid dosing errors. If your child is hospitalized and receiving ibuprofen intravenously, like Caldair, doses are weight-based and carefully monitored. Hydration is important before ibuprofen to protect kidney function. Juvenile rheumatoid arthritis, JRA. For kids 1 year and older with JRA. Dose, 30 to 50 milligrams per kilogram per day divided into 4 doses. Doses above 40 milligrams per kilogram per day may increase risks. Higher doses are not recommended. Clinical improvement may take days to weeks. Doctors will adjust the dose to the lowest effective amount. Special use: premature infants with patent ductus arteriosus, PDA. Ibuprofen lysine, neoprofen, can be used in premature infants weighing 500 to 1,500 grams and less than or equal to 32 weeks gestation to help close the PDA, a heart condition in newborns. Initial 4 dose, 10 milligrams per kilogram once, followed by 5 milligrams per kilogram at 24 and 48 hours, 3 doses total. Kidney function must be closely monitored during treatment. Pediatric dysmenorrhea, menstrual cramps. For girls 12 years and older, 200 to 400 milligrams every 4 to 6 hours as needed. Max dose, 3,200 milligrams per day, prescription, or 1,200 milligrams per day, OTC. Start treatment early when cramps begin for best relief. Final pediatric safety tips. Always dose by weight whenever possible. It's the safest approach. Use the lowest effective dose for the shortest time to minimize side effects. Watch for signs of stomach upset, rash, or unusual symptoms and contact a healthcare provider if these occur. Never exceed the maximum daily dose, and keep ibuprofen out of reach of children. In summary, ibuprofen is effective and generally safe when used properly. Follow dosage instructions, take it with food, avoid mixing with other NSAIDs or alcohol, and consult your healthcare provider about any concerns. Using ibuprofen correctly means you get relief without risking serious side effects. Stay informed, stay safe, and listen to your body. If you want more detailed dosing charts or help with common questions, leave a comment below. And don't forget to like and subscribe for trusted health info made easy.